Welcome to Emergency Chaos, where we provide tips and tricks to make you a better ear nurse. Today, we are going over 10 tips I believe you as a new ear nurse should be aware of. While at work, I'm trying to be more proactive with noting down tips that may be useful. So hopefully, little by little, I can post more mini videos like this. Thank you for watching. So as far as the first tip, only regular insulin can be administered IV. Please ensure you're extra careful when drawing up insulin. Ideally, you want your preceptor by your side, ensuring you are drawing up the correct insulin. But do keep in mind that just because regular insulin was ordered, it is not just always for IV. It can also be sub-Q. So again, pay close attention to the route ordered. But for this tip, only regular insulin can be given IV. Next, have you ever heard someone say B52? What does that mean? It means Benadryl, 5 milligrams of Haldol, and 2 milligrams of lorazepam. This combination of medications are referred to as a B52 and typically administered to combative patients who are at a high risk of seriously hurting themselves and or others. Note that I have seen recently providers switching from Haldol to Zyprexa, still ordering the other meds, but instead of Haldol, ordering Zyprexa. Now, your critical patients need to have at least 2 IV lines. You will most likely end up having different types of drips, and not all of the medications are going to be compatible with each other. So you will need more than one IV line to give different medications. Try doing this early on. It's going to save you time, especially as the shift goes on and it gets busier and busier. If your patient is coming in for a respiratory condition and they look like they are in respiratory distress, place the pulse oximetry on first. It's a key vital sign that must be obtained first in these situations. So again, place the pulse ox first. After you place the pulse ox, then you can do the blood pressure and connect the ECG leads. Now, if you can palpate a carotid pulse, the BP is at least or approximately 60. If you can palpate a femoral pulse, it's going to be the blood pressure will be at least 70, and if you can palpate a radial pulse, the BP will be at least 80. Now, if your patient starts having rhythm issues of any sort, like throwing runs of VTAC, you need to review the electrolytes to ensure none of them are out of range. As we know, the electrolytes have a big impact on the heart and can be the cause of these disturbances. Super quick on a side note, I made a mini book out of the topics we've discussed on the channel, plus content from future videos like IV tips and what to expect during a cardiac arrest. If it sounds like something that might interest you, or perhaps you would like to further support the channel, please check it out on Amazon. The link will be provided down in a pinned comment. Next tip, make sure you obtain blood cultures prior to giving antibiotics, especially in your septic patients. Doing so can make it easier for the offending organism to be identified, and hence the correct antibiotic can be given to the patient based on that organism. Now, for all your patients, place the IV in the forearm when possible, as you are not going to have the issue of them bending their arm, and despite education, they're still bending the arm, occluding the IV side. So if you place the IV in the forearm, you don't have to worry about them bending their arms, and the infusing medication will just keep on going without the IV side being included from their bending. Next, when you're cleaning patients, place 2 pairs of gloves on. For example, with the first pair, you turn the patient and perform the cleaning. Then you remove the first pair. Now you have the second clean pair that you can use to continue making the bed and tidy everything up. And then for the last tip, I know that as ER nurses, we need to be proactive with setting boundaries. It is not a hotel and we are not maids. However, if family is visiting, especially if your patient is very critical, provide chairs, tissues, and even water if possible. I know that it has been extremely busy across emergency rooms recently, but we cannot lose sight of why we started this, which is to help people during difficult times. So again, it's always going to be important to set those boundaries. But if possible, if you're free, if there's no one actively dying at this moment, especially for your critical patients, for their family, when they do visit, help provide chairs, tissues, and water when possible. Thank you so much for watching. I would really appreciate a like and a follow, and if you learned something today and would like to help support the channel, please consider getting the mini book I put together on Amazon. The link will be in a pinned comment below. As always, you should continue nurturing your curiosity and continue learning daily. With that in mind, please watch my other videos, and I've also listed my favorite ER nursing related books in the description text and in the comments as well. So when you get a chance, please check them out. And if you've learned something recently while at work that may be helpful to other new ER nurses, please consider sharing it in the comments so that we can all benefit and help each other out. Thank you. And as always, teamwork makes the dream work. And here at Emergency Chaos, we are proactive, not reactive.